My name is Stuart Kimball, and for my mini case number 3, will be on patellar tendinopathy. Patellar tendinopathy is the degeneration of the patellar tendon located in the knee, which is located by the highlighted red portion. The anatomy involved is the patellar tendon as well as the inferior pole of the patella. This is a chronic injury, so the signs and symptoms mirror most chronic injuries such as inflammation, edema, and pain. Signs and symptoms pertaining to patellar tendinopathy, or PT, involve pain over the inferior pole of the patella, and then pain with movement of the knee when flexed or throughout power movements in the knee, such as jumping, cutting, or other power movements. Epidemiology and risk factors include individuals aged 15 to 30 are more prone to this injury, and males are more prone. This is commonly found within sports such as basketball, volleyball, jumping events, tennis, and football, or any other sport activity that requires the repetitive loading of the patellar tendon. Red flags or clinical indicators include sports that involve repetitive loading of the patellar, such as those listed before, and pain when the weight load is removed from the patella. Pain that stops when the weight load is removed from the knee. Evaluation examination. Your eval should begin with an extensive history to include highlighting or questioning the red flag and clinical indicators mentioned on the last slide. Because there's chronic injury and there are no clinical tests that are able to be performed, once the history has been concluded and you are suspecting that there is a PT injury, you should refer the patient to an imaging specialist. Typically, MRIs are used to diagnose soft tissue injuries. However, Doppler ultrasound is more accurate at confirming PT than MRIs. Other imaging software include ultrasounds with a sensitivity and specificity of 72.5% and 43.3%. Doppler is reported at 12.5% and 100%, and ultrasound elastography is 70% and 53.3%. There are 4 phases to measure PT. Phase 1 is pain during post-exercise. Phase 2 is pain at the beginning and at the end, but ceases after the warm-up period of exercise. Phase 3 is pain during and after activity or throughout, and Phase 4 has been added, which is a complete tendon rupture. Surgical intervention. Typically, it is recommended to attempt 6 months of clinical treatment or non-surgical intervention before pursuing surgical intervention. Non-surgical intervention includes eccentric exercises to strengthen the knee area with emphasis on knee loading. This includes squats, weighted or body weight squats, and single leg step downs or other eccentric exercises. Surgery currently is being done arthroscopically, and the surgery is debridement surgery, which is the removal of only the diseased portion of the patellar tendon, and it can even include debridement surgery of the inferior pole of the patella if that is damaged or diseased as well. The thought process behind this is that by removing the diseased portion, you will stimulate the healing process and increase blood flow, which will overall create a healthier environment within the knee and the patellar tendon and inferior pole of the patella area. Previous surgeries, in the 1960s, it was recommended to create holes in the patellar tendon, which would then stimulate the healing process. In 1980, it was then changed to create 4 vertical strips along the tendon and removed all the diseased parts of the tendon, whereas now it's removed just the diseased parts and cut out those that aren't needed. Indications of this type of surgery is, as mentioned before, 6 months of failed conservative treatment. The post-op and devices that are needed, typically you will be placed in a knee immobilizer prior to surgery or after the problem has been reported until rehab can be conducted for the 6 months. After the operation, you will be again placed in a knee immobilizer for about 2 to 4 weeks to limit knee extension to include crutches with the knee immobilizer. After the surgery, you will increase the weight bearing that is tolerable by the patient, and it is reported that all cases there's a 6-month no return to play, but after the 6 month players can return to play or activity. The downside of PT or the surgery is that 53% of all reported cases, an athlete does not return to the activity due to the injury. Thank you. This concludes my patellar tendinopathy mini case. And here are my citations.